So many parents right now are scrolling Facebook and searching Google for a word called dysautonomia. I know, it sounds pretty funky, and some of you may have never heard of it before, and some of you maybe have heard a really surface level explanation from your MD. But I'm here to explain it to you in detail because there are way too many kids and teens and adults who are struggling with dysautonomia. Now, dysautonomia is a condition affecting the autonomic nervous system. So remember, your nervous system is your brain, spinal cord, and all your nerves, and it is the boss of your body. It controls absolutely everything. We call it autonomic because 99% of what it's supposed to do is on autopilot. It's supposed to run well on its own without you thinking about it, and it's supposed to do a good job at that. And dysautonomia is when that isn't happening, when it's disorganized or when it's not functioning properly. Now, most people right now don't know about dysautonomia because the doctors aren't looking to the nervous system when we see any kind of struggles. If someone has a heart condition or an immune challenge, they're not looking to the nervous system. They're looking at two main modes of testing. They're looking at blood tests, which is checking the chemistry in your body, and they're looking at imaging, like an X-ray or an MRI, to see what things look like. But neither of those two tests are actually checking the function of your nervous system. We are seeing so many kids in the office right now that are being challenged with anxiety, with sleep challenges, with brain fog, with fatigue. This is dysautonomia. So the simple definition of dysautonomia is an out of balance autonomic nervous system. Now remember, our nervous system has two sides. It has that gas pedal stress side, that fight or flight. And then it has our chill and relax side where we socialize and communicate and sleep and digest. And when that base system is out of balance, it's going to affect all of those systems that it's controlling. Our gut, immune, hormonal, mental, those systems are going to start not functioning properly, and we're going to start to see symptoms and conditions. When we see the gut system go off in a baby, we're going to see challenges like reflux or colic, maybe constipation as they get a little bit older, or then when they turn into young kids, where maybe we see that nervous belly or that constant tummy ache. We know that the gut and the immune system are closely related, and when that immune system starts to get stuck, the congestion is going to happen. We're going to see the ear infections, maybe chronic strep conditions, asthma and allergies, and then mood and focus and emotions are going to get stuck, and we're going to see challenges like ADHD, ODD, and more anxiety. And then, of course, that motor system, as it gets stuck in that stress mode, maybe we're going to see some challenges with coordination. We're going to see that tension through the body, maybe the tone of the baby's system, or we're going to see headaches as they get older with the tension. This is what dysautonomia looks like. And I know there is one system that ties it all together, and it makes the answer so simple that you're going to be wondering why you've never heard this before. And in fact, I hear that all the time from parents, because when that one system goes offline, all the other systems are going to suffer. But here's the good news. When we address that one system, all the other systems can improve and get better. So what is causing dysautonomia? I'm going to throw another big word. It's called subluxation, and it has three pieces. It first has misalignment. That's misalignment of the joints within your spine that are protecting your nervous system, especially in your neck. Think about how important your neck is. We all cringe when we watch football, making sure that those players don't land on their neck, or when we're holding a baby, we make sure to protect their neck. But then we go and cause stress to that area with birth interventions like forceps and vacuums and C-sections. And then we spend so much time with our necks like this right from a young age, looking at our tablets and our phones, causing that misalignment. That misalignment then leads to tension and fixation in those areas. And that fixation leads to that neurological imbalance, which is where we started. That imbalance of your nervous system is when your nervous system gets stuck on that gas pedal side. We have too much gas and not enough brake. We're kind of living in that stress mode, and we're not getting enough of that chill and relax mode. We're not letting that vagus nerve do what it's supposed to do so that all of those functions in our body can work a little bit easier. So how do we find this subluxation? That's where a trained chiropractor comes in. In our office, we use safe, simple scans to test your child's nervous system. We want to see if their system is imbalanced. We want to see if their nervous system is stuck on that gas pedal side. We want to find out if dysautonomia is the answer that you've been looking for. And if it is, we're going to show you, we're going to explain it to you and explain the results and what that means. But most importantly, we're going to talk about if we can help your child. I hope that this video gave you a few answers that you were looking for. There is a more detailed article that's linked in my bio that's going to explain dysautonomia. It's going to show you how these systems all come together, and there's going to be extra links in the article so you can understand exactly what's happening with your child. Please take a read. Please comment if you have any questions. Send me your questions. We're here for you.